says 12:03, so let's go ahead and begin. First off, I just want to say good afternoon and thank you everyone for joining us for today's webinar. My name is Melissa Pluckelman. I'm the Outreach Specialist with the Medicine Center, as well as the National Children's Center for Rural and Agricultural Health and Safety. I'm happy to serve as the moderator for today's topic, research and results surrounding rural and agricultural mental health. May is Mental Health Month, and we want to bring light to the topic of mental health through the Farm Neighbors Care campaign. The campaign asks rural residents to have face-to-face conversations with farmers and agribusiness owners. For some, this conversation and check-in may be the dose of positivity needed to make it through a tough day. The Farm Neighbors Care campaign is a collaborative effort between many agricultural organizations in the state of Wisconsin. I also want to remind everyone to nominate someone they know for Heroes of Hope. This effort is focused on shedding light on rural heroes who have helped others through a tough time. Maybe they're helping their neighbors harvest crops while they go through a tough time, or just providing positivity in their day-to-day careers. Maybe uplifting other farmers to help them get through a tough season, anything like that. Heroes of Hope aims to identify people who have helped bring hope to farmers or businesses, either in large or small ways. Members of the agricultural community are encouraged to nominate individuals who have made an impact on the way they conduct business, both ordinarily and extraordinarily. To nominate someone you know, visit the Wisconsin Farm Bureau website at wfbf.com. Before we begin with our panel, there's just a few housekeeping items. Please keep yourself on mute throughout the webinar. If you have a question at any time, please put it in the chat box or feel free to raise your hand to be called on. Lastly, again, this webinar will be recorded and posted later this afternoon. Now, I am very happy to welcome our panelists for today's discussion. Our agenda today is that the three panelists will each speak and share a little bit about their background and their research. And then at the end, we'll have a discussion kind of question answer period. So again, if you have questions at any time, feel free to put them in the chat and we'll bring them back to light at the end, or write your questions down and save them to the end. Our panelists today are Dr. Josie Rodolfi, Dr. Florence Bicat, and Dr. John Schutsky. Each of these individuals has done or is in the process of some research project relating back to agricultural and rural mental health. So I am going to start out. First is going to be Dr. Josie Rodolfi. Dr. Rodolfi, you may share your screen while I introduce you. Dr. Rodolfi is an assistant professor at the University of Illinois, Urbana-Champaign. She enjoys teaching, and her top areas of research interests include child agricultural injury prevention, young adult agricultural workers, and of course, rural and agricultural mental health. Josie is also an associate research scientist for the National Children's Center for Rural and Agricultural Health and Safety. Josie, thank you so much for joining us today and sharing your research.
Thank you so much for that introduction, Melissa. Thank you all for being here. Just as a housekeeping, Melissa, feel free to cut me off whenever we need to move on. I think most of us could relate when we say we can talk about this for a very, very long time. Tend to do so when given the opportunity. I'm Josie Rodolfi. I'm going to talk a little bit about some of the farm stress and mental health research projects that we've either recently completed or that are underway. So as most of you know, agriculture is a very hazardous industry. It's characterized by high fatal and non-fatal injury rates. We also talk a lot about some of the really unique occupational or work-related stressors. A lot of us, though we do believe the weather impacts the way we work and the way we react, we are probably not as dependent upon weather cooperation for us to perform some of our very, very mundane daily work tasks. Similarly, we are all very concerned about first personal finances, but some of us have the luxury of a payday that comes probably every month or every 2 weeks, and we probably have a pretty good idea of what we should expect for those paydays, which is certainly not a luxury that people in agricultural production experience. And the occupational health model would suggest pathways between chronic stress and mental health conditions such as anxiety, depression, and substance use. However, there's still a lot we don't know about rates, prevalences, or incidence rates related to mental health conditions in agriculture. And that's really where a lot of my work comes into play. I was trained in a public health program. I really appreciate the public health approach. The public health approach would suggest that first we have to really do high quality surveillance. We have to determine the burden of a disease in a population. And in my work, we typically talk about the rates of suicide, prevalence or incidence rates of depression, anxiety, and other types of mental health conditions. And then we need to identify risk and protective factors. What are those either individual, perhaps, or occupational characteristics that may contribute to the development of the disease or protect against the development of the disease? From there, we want to develop and evaluate interventions to hopefully protect against some of these mental health conditions and eventually implement these types of interventions big picture. A lot of my work is still very much in the early phase of some of this type of work. Like I said, I focus primarily in surveillance. To an extent, I would not call it surveillance properly, but I would say that's where a lot of my work is, and then thinking about risk and protective factors. So one opportunity we had, thanks to the pandemic, which I never thought I would ever say, but we were able to survey agricultural producers. We talk a lot about stress around agricultural work. And we realized that COVID-19 impacted everybody in various ways. And we'd certainly, early in the pandemic, we're hearing about how agricultural workers and agricultural producers and even stakeholders, those people who operate in agriculture, perhaps not as a producer, but as certainly somebody in sales or in product placement, how the pandemic was impacting them negatively. And we thought in order to really inform some of our extension work, we needed to know a little bit more about how COVID-19 was created unexpected stress for some of our producers. We surveyed just under 2,000 producers and stakeholders online in April to May of 2020. The survey was distributed via Illinois Extension and also Illinois Farm Bureau. 90% of our respondents, I should say, were from Illinois, but other Midwestern states were certainly represented. The survey collected information on demographic characteristics, which I'll show on the next slide. And then a number of open text questions, one of which asked, what are the most pressing or concerning stressors related to your job? In the context of COVID, how has COVID-19 changed the way you work? How has COVID-19 changed the way your family, functions or behaves on a daily basis? Questions like that. We also screened participants for symptoms of anxiety and depression using the PHQ-2 and the GAD-2. These are brief screening instruments for depression, which is the PHQ-2, and anxiety, the GAD-2. So to give an idea of who responded to the survey, this is a big table, but I'm just going to kind of provide general overview. Over 80% of our respondents identified as an agricultural producer. The mean age was, I believe, 50.7. Over 80% identified as men or male. You could see education was kind of split, but almost 50% were a bachelor's or above. And 70% were self-employed. When we think about, what agriculture producers in the Midwest look like, these are very, very similar to the demographics we see presented in the Ag Census. And we talk about self-employed. I think that's really important from an occupational safety and health standpoint. We certainly were interested in knowing what kind of COVID protocols were put in place. And we realized that large employment systems, are regulated or mandated to provide some sort of protection, but we know that agriculture is often exempt from those types of regulations, and then the self-employed are protected even further. But we know that almost 60% of farmers reported experiencing at least one symptom of depression or anxiety. And this is higher than what's been reported in COVID times. A recent publication during COVID-19, I'm reading the citation here, found that between 36 and 42% of the general population reported at least one symptom of anxiety or depression. So you can see 59% is higher than 42% that we see in the general population. We also know, based on responses to the PHQ-2 and the GAD-2, or excuse me, the GAD-2, yes, almost 20% met the criteria for generalized anxiety disorder, and 13% met criteria for major depression. And you can see the items that contribute to those GAD-2 and PHQ-2 scored below. And these are higher than what's typically reported for the general population. However, we don't have a good comparison of the general population during COVID-19. So we do have to acknowledge that as a potential limitation here. I think what's most interesting is what we were able to glean from some of the text box responses, the ones that I felt were appropriate, I guess, for the screen. We got a lot of respondents. There's a lot of opinions out there, but most people, if we had to sort of identify major themes, a lot of concerns were related to prices of commodities, certainly personal finances, and then also issues related to supply chain. So either not being able to get what they needed. Keep in mind, we were surveying individuals during spring of 2020. The pandemic was relatively new, but farmers were also trying to be in the field. And so supply stores weren't open. We oftentimes weren't meeting face to face. And for some farmers, that was certainly an added stress. There was a lot of concern in the Midwest about packers closing. I worked with the Iowa pork producers to develop some immediate sort of stress and suicide prevention resources because of the concern for animals not being able to go to market, and perhaps the need for like mass depopulation, and the concern that I think was never totally realized, but certainly something that people were very worried about. And then obviously concerns over the virus and keeping themselves safe. We know that sick days are also not a luxury for some agricultural producers. Keeping themselves safe and healthy, keeping their families safe and healthy, and then of course keeping their workers safe and healthy. So we're working on a number of publications to come out of this, this information. One was just recently submitted to the Journal of Rural Health. I'm going to talk briefly about the North Central Farm and Ranch Stress Assistance Center. This is a 12-state, 15-partner collaborative that's working to expand resources and services to agricultural populations in our 12 states. We are in the midst of a very large survey effort. We're surveying over 12,000 producers in that 12-state region. We're screening for anxiety, depression, and substance use. We're identifying some of the preferred sources and channels of mental health and stress-related information. This expands on a pilot project that we did in Wisconsin that identified some of the preferred sources and channels of mental health related information among farmers in Wisconsin. We're also using a really interesting instrument to identify some of those barriers to seeking or obtaining mental health care. And then finally asking about participation in USDA programs as requested by USDA in the RFA. So how often are people participating in some of the farm mediation programs, crop insurance programs, and then being able to see at least if there's an association perhaps between participating in some of those programs and then mental health status. So we are currently in the data collection phase, which is very exciting. There's tons and tons of mail coming into my office every single day. So we anticipate results hopefully by August of 2021. And I'll just talk briefly about the project that I have had the opportunity to start collecting data from with the National Children's Center for Rural Agricultural Health and Safety. This project, Farm Adolescent and Adult Mental Health, I am really excited about this and super passionate about this. I was raised on a farm family. I think we can all acknowledge that children are not naive or ignorant to what's happening in a family, whether it's a farm family or not. And the conversations about the farm typically interfere with perhaps dinner time or other types of family time. And so recognizing that children are probably experiencing some of the stress that's occurring on farms and perhaps even experiencing some of perhaps mental health conditions similar to their parents. We wanted to test the family stress model to determine if there are associations and causal pathways between economic hardship, sort of parental manifestation of that, and then how that impacts children and how children then display behaviors, whether they be internalizing or externalizing behaviors. So we're asking a lot of questions of parents and farm adolescents related to obviously anxiety and depression, but also substance use, violence, other sort of health risk behaviors. This is a multi-step process. We just mailed preliminary recruitment materials. So we sent out a flyer to 1,000 farm families in a 5-state region to hopefully build a little enthusiasm and excitement for the project. And we're making minor tweaks to the survey instrument after pilot testing it among a couple of adolescents and preparing to mail recruitment packets to households within the next 2 weeks. Once we do that, it's a completely online process. Primary producers, adolescents, and then primary producer partners can complete the survey, consent forms, et cetera, online and be sort of auto-sent links to the appropriate survey through a very sophisticated RedCap system. And then we basically auto-send a Amazon gift card for anybody who participates. So it's a bit of a complex process, but we are really enthusiastic about this and hope to have results by late summer. And Melissa, that is all I have for today.
Excellent. That's perfect. Thank you so much, Dr. Rodolfi, for sharing your research with us and letting us know what you're up to. Next, we're going to have Dr. Florence Bicat. And Dr. Bicat, you can share your screens while I introduce you. And just to all of our audience out there, remember, if you have any questions, feel free to type them in the chat. Dr. Florence Bicat is a rural sociologist with 10 years of agricultural interdisciplinary research experience. As an associate scientist at the Marshfield Clinic in the National Farm Medicine Center, her research program focuses on the health, well-being, safety, and economic viability of farm families in the United States and France. Her research first considers the ways in which difficulties meeting social needs, such as healthcare, childcare, or aging, expand beyond the confines of the personal sphere and can have direct implications on the farm, including the adoption of farm safety practices and farm business development. Dr. Bicat earned her PhD from The Ohio State University and was previously a researcher at the University of Vermont Center for Rural Studies. Dr. Bicat, take it away.
Thank you, Melissa. Thanks for the kind introduction. And good afternoon, everyone, and thank you for coming today. So I think that my presentation, the presentation of the research I will do, I think will flow nicely in after Joseph's presentation on the challenges that farm families face and the prevalence of mental health challenges. What I will be talking today is I will be presenting research on supporting the mental health of farm families in the US Midwest. And I will make a note that I did this research with a group of researchers at the University of Minnesota, Carrie Inning-Smith and Andrew Alberth, Shoshana Elwood at the Ohio State University, Andrea Bornstadt at South Dakota State University, and then myself at the National Farm Medicine Center. So I won't go into much of the details of why we did this study in the sense that I think this group is well aware of the challenges in the agricultural sector. And what we wanted to do was to understand what type of supports are available for farm families in the Midwest. And what I will know is that the research I'll be presenting today is focused on the 12th state North Central region. But towards the end, I will talk about specifics for Wisconsin and what has happened in Wisconsin since we conducted the study. So in terms of our research questions, they were pretty straightforward. What are the challenges faced by Midwest farmers? We wanted to understand if the challenges that Midwest farmers are similar or different than challenges faced by farmers in other regions of the country, as well as in other parts of the world. We wanted to understand how we should address their challenges from the perspective of people in the agricultural sector. We wanted to understand what types of supports are available. And last, the goal was to identify potential gaps in resources and support available. So we went about this research through two main research activities. On one hand, we talked with 19 farmer mental health experts from the 12 state region that I mentioned, and this included a range of experts such as researchers who focused on the mental health of farmers. It included folks who work in agencies of agriculture on issues connected to mental health. And the last piece that I will mention is that we had a few folks who were farmers themselves. So they were not only considered, they might be working for extension and at the same time they have a farm. So we did get some of the perspective from the first hand. The other activity that we did was an environmental scan of farmer mental health resources. And you can think of an environmental scan very simply from the perspective of doing online searches to understand what is out there. So in other words, if somebody was to sit down at their computer looking for farmer mental health resources, what will they find? And so we did that. We looked at those resources for the 12 states. And the last piece that I will mention is that the study was conducted in 2019 to 2020. It might not seem like a long time ago, but in reality, a lot of things has happened since we conducted the study. There has been a lot of changes in resources, and I will touch on those a little bit towards the end. So the first slide is on challenges faced by Midwest farmers. I don't want to go into the details because, again, I think that those challenges are well understood by this group. But what I do want to say is that when we spoke with the experts, when we did interviews with them, they really talked about challenges along a continuum in the sense that there are some challenges that we can think of in terms of a macro level change where people have an ability to influence and to make a difference. And on the other hand, we know that there are other challenges where we can think of them in terms of macro level, where folks don't really have much of an ability to influence, yet those things directly impact health and well-being of farmers. So to give you an example, just looking at the first line focused on finances, for instance, the level of debt that a farmer has might be able to restructure that debt by working with a financial expert. But on the other hand, prices and tariffs, commodity prices, oftentimes folks don't really have a say, or it's very difficult to make changes connected to these things. The other, one aspect that we heard a lot about when talking with the experts, and that I would say we don't specifically ask about, but it just kept coming back in the conversation. They talked about how diverse the farm population is. And they talked of diversity in terms of individuals, in terms of farmers and their families. So they talked about, for example, differences in terms of age, where we know that younger farmers can face higher level of stress as they are starting both their families and taking over the farm business. They also talked about differences in terms of gender, race and ethnicity, and family structure. For example, is someone single versus married with kids? They also talk about variations connected to the farm operation in terms of scales, commodities, and region. And the idea, essentially, what the importance of thinking about the diversity of farm population is connected to not only there are going to be differences in terms of the challenges and in terms of needs, there are differences in terms of coping strategies. What do people do when they're experiencing challenges? How do they respond to what's happening to them? And we tend to talk about coping strategies in terms of positive and negative strategies. And the other piece too that those experts emphasized was that the solutions for different groups of farmers might be different. So for example, for a younger crowd, you might be able to disseminate information through social media, whereas an older farmer might be less comfortable with that. Or even we could think in terms of where people live and rurality of where they live, you know, and broadband access. So in other words, there's just a lot of variations to think about. So when we asked them about what are ways to address challenges faced by farmers, the folks that we talked to talked about 3 different buckets. On one hand, they talked about the importance of education, the importance of reducing stigma, the importance of increasing awareness of mental health challenges, as well as increasing knowledge of existing services. And I think that a webinar like today can play this role when we talk about, in the campaign that the Farm Bureau has been doing with the coalitions of groups in Wisconsin, does play a really important role in talking about mental health challenges and in working towards reducing stigma. The other thing that experts talked to us about was the importance of increasing access to care. They talked about the importance of increasing the numbers of providers in rural areas. We know that rural areas in the US as a whole often have, they are short on specialists, and that includes behavioral care. Another thing that folks talked about was the importance that those providers would understand rural and agricultural challenges. Talked about how some farmers might be hesitant to go see a healthcare provider if they feel that the healthcare provider just doesn't understand what it's like, you know, what their reality is like. One thing that was talked about as well was the importance of crisis lines and mobile crisis units, so that there is help available, in particular when a large challenge hit. And they also talked about not only the idea of access, but also the idea of affordability, which can be challenges due to a high health insurance cost, and the fact that some plans do not cover mental and behavioral health. The last piece that those experts talked about was the importance of addressing root causes of farmer mental health challenges, talked about financial succession planning, issues connected to loneliness in rural areas and lack of social contacts. And then the last piece was addressing underlying financial stress connected to agricultural markets. In other words, if a source of stress is the farm economy, what can we do to address that? Is essentially what those experts were talking about. So in terms of the types of supports available, so I'm going to present very quickly the findings from the environmental scan, which as a reminder was when we searched the internet to see what was out there. Over the 12 states at the time, we found 121 distinct programs with 162 individual components. And those were from a range of organizations. They were from agricultural groups, departments of health and agriculture, extension services, and so forth. What we found was that most frequently the resources were what we think in terms of self-help, fact sheets, web pages, workshops, and conferences. And I'll get back to those in a second. And then the least often found was what we think in terms of mediated help, where there is one-on-one help where a farmer will reach out to, it could be a peer farmer who is available to talk about who is out there and working at a crisis hotline, or it could be access to a healthcare provider. The last piece I will note about what we found was about 2/3 of the resources were targeted directly to farm families. 10% of the resources were targeted to agricultural service providers, and those tended to be resources essentially to help agricultural service providers who are working with farmers. So what do they do if one of the clients that they work with is experiencing distress? What can they do to help them and direct them towards resources? So here is I'm going to bring together what we heard from the experts and what we found through the environmental scan. And as a quick note, this was, the research is already, from a couple of years ago, and there has been work on that area. But at the time, here's what we were hearing and seeing. We were hearing from the experts about the importance of education, and we found through the environmental scan that there was a lot of resources connected to that. Indeed, the majority of programmings were self-help, focused on identification of stress symptoms, methods of stress management. A lot of the resources too, a few resources were training for service providers to identify mental health issues and direct farmers to help. And in short, these appear to be efficient, low-cost means of reaching farm families which may help reduce mental health stigma and increase awareness, but their effectiveness in the long term may be limited. And so the second bucket of recommendation was connected to access to care. What we found is that many of the resources were about increasing access, or maybe I should say use to care indirectly and indirectly, in the sense that, a lot of the resources said if you're experiencing problems, here's what, go get help in some ways. But what we found too is some of the help around crisis hotlines and mobile units may not offer sustained help or help for more serious mental health problems. The other thing that we didn't find were resources connected to health insurance, even though we know from other research that the cost of health insurance is a stressor for farmers. And we also know from previous research that not all farmers know if their plan covers behavioral health. To give you an example from a previous study, when we asked farmers, does your health insurance plan covers mental health? 33% didn't know. So the last piece too, in terms of addressing root causes, what we found is that the root causes of mental health challenges connected to the agricultural economy, the weather, they were often mentioned in material to explain challenges. And what we found was mediation services and training to help farm level difficulties, help with farm management, and looking at the books and seeing what folks can do to improve things. But at the same time, we didn't see much to address kind of the larger issues connected to the way maybe agricultural policies might be working or the agricultural economy. But at the same time, we can also say, the kind of resources that we're looking at are targeted to farmers, not to decision makers. So the last piece that I want to cover is practical implications. Based on the findings that we were seeing and based on the gaps that we were seeing, it seems, and we can think in terms of micro level and the things that maybe are going to be easiest to implement, and then micro level, which are going to be harder to implement. It seems that more information on health insurance coverage, where farmers can get help if they want to change their coverage, it would probably be helpful. And also checking plans, does it cover for mental health? Telehealth too is another piece that has really come up since last year with COVID-19, where what experts were telling us was that telehealth will likely play a very important role around stigma and farmers not to have to be seen when they go seek help. And some more information about how folks can access telehealth services, since those have been increased with the pandemic. The other piece too is, are there opportunities to provide links for farmers around financial support, since we know that oftentimes there are challenges connected to the finances, and there has been more of that since last year with COVID-19 and some of the financial support that have become available. So in terms of access to care, one of the opportunities is training of healthcare and agricultural service providers to develop a greater understanding of some of the challenges that folks might be facing. And in terms of more difficult, it will be connected to increasing mental health coverage and assessing and retaining recent changes in telehealth. And the last piece, I think I'm running out of time. I'm sorry, I can't see a clock where I'm sitting, is to address the root causes. What can we do so that we can decrease significantly the levels of stress so that folks don't have to seek care from behavioral health providers, or so that, the stress is reduced. And so that brings up questions connected to the intersections between the agricultural economy and policies, as well as farmer mental health. So the last piece that I will mention is the changes since we conducted the study and moving forward. So there's been an increase in resources since last year, since we conducted the study. Josie mentioned the North Central Farm and Ranch Stress Assistance Center, which has a lot of additional resources. And here in Wisconsin, we have the great work from the University of Wisconsin Extension, that CAP, which I think will be presenting next week, and as well as campaigns such as this one that are really bringing awareness to the issue. And for us, in terms of the research, that brings up questions about how farmers are interacting with these resources, and are these resources helping relieve some of the mental health challenges. And that is all I have for today. And I included those links that I can share later if folks are interested in reading the findings of the study. Thank you.
Thank you so much, Dr. Bicat. And those are some great follow-up questions that you have. Our resources really working and our farmers really connecting with them. So thank you so much. We look forward to our question and answer period with you at the end. But now we will move on to Dr. John Shutsky. And Dr. Shutsky, I see you're already sharing your screen. Excellent. In 2016, Dr. Shutsky returned to his faculty home in the UW Biological Systems Engineering Department. He has a split extension and teaching research appointment. His activities include research and education to help people apply, design, and evaluate new technologies, including sensors, robotics, automation, and wireless communication systems, especially to reduce injuries and other negative health outcomes for people and the environment, while simultaneously pursuing enhanced profitability. Dr. Shutsky also has an affiliate faculty appointment with the UW's Family Medicine Department with the School of Medicine and Public Health. The relationship includes working with health professionals, extension colleagues, and agricultural service providers to reduce the burden of occupational illness and injury in farming. Thank you, Dr. Shutsky, for talking with us today. Go ahead and take it away.
All right. Thanks, Melissa. I really do appreciate the opportunity to present. Thank you for asking me. I also want to just commend the whole group of people that are part of this Heroes of Hope, Neighbors Helping Neighbors effort. I think it's really special. I think Wisconsin is a special place that we can come together with these coalitions that are working across the state. Obviously, Extension is a part of that. I'm going to present a little bit of research here, but also just to kind of frame things as Melissa introduced me. Our unique work in Extension is being connected to the land grant mission. And obviously that means being connected to the Farm Medicine Center, to UW-Madison, and other places, including Josie's work, Dr. Rudolphi's work down in Illinois that she talked about as the first speaker. I also just wanted to mention, I also direct the Center for UW, or the UW Center for Agricultural Safety and Health. Before I jump into that first slide, the other thing I wanted to just mention, been doing a little bit of traveling here as we kind of come out of COVID. And one of the things I'm hearing is people saying like, oh, thank goodness prices are looking better. Corn markets are doing well, row crops, cash grain, things like that. And dairy's doing a little bit better than it was. And I just want to say, even during these times, the stresses that Dr. Rudolphi and Dr. Bicat talked about, they're still out there. They may be a little bit different. It may be more about managing in a fast-moving, complex environment. But even with things improving, we're still going to see considerable stress in agriculture. Florence talked a little bit about this. We do have a website. I wanted to just, again, point out the fact that the work we do in Extension is research-based. Our Resilient Farms, Families, Businesses, and Communities website or resource center has been around since the early part of 2019. There have been a group of about 30 of us working on this across the institution, and then obviously connecting with partner organizations, including many of you who are represented on this particular Zoom. If you look down in the bottom right-hand corner, I'm not going to repeat the whole URL, but if you search like Resilient Farms and Families, you'll find us. And you can also find us on Facebook with a Facebook page that's just Farm Stress. So we were, we kind of got in early on the social media move in this area back in 2019. It's kind of organized around 4 zones or 4 areas where the current research is focused. That's the 4 icons down at the bottom, the sort of like medical physiology of how stress affects us, including how it affects our brain and decision-making, the science around stress management, communication. A lot of that work is actually based on things that were done at Michigan State a few years ago. And then your Farm Future is about the economic interventions or the economic financial management techniques and the financial literacy that's needed to manage during these complicated times. So again, just encourage you to go out and seek out the resources. And I think, Melissa, there will be some resources talked about next week as well. I wanted to just spend a little bit of time. I don't know that we've really talked in detail about Wisconsin suicide data. among the farming population. And right now, I would say, if we're talking about being in its developmental stages, we're kind of very much in the early infant stages in this area, at least more with the recent data. So I wanted to just highlight this briefly. I guess I would call this a small scale pilot project. Collaboration with the National Farm Medicine Center, UW-Madison, through my work in CALS and Extension, and also the Wisconsin Department of Health Services. And give you a shout out to Brian Weichel, Rick Burke, and Emily Redman, who were at the Farm Medicine Center, who were really the organizers of this work. What we began doing, probably in the latter part of 2019 and definitely in 2020, we began to do a fairly systematic examination of farm fatalities. So these would be the kinds of things you would typically think about as farm accidents or issues connected to farm safety, tractor rollovers, collisions on highways. And we did a really deep data dive through both death certificates and also the Ag Injury News database. What we learned is that we had 41 fatalities in 2017, 34 in 2018. But my point that I wanted to make on this is, as we did this work, we began to see a really relatively large, and for us, I think somewhat shocking number of farmer and farm worker suicides, or suicides that occurred on farms. And because of our protocols and because of the way we had organized our research, we decided to hold those until this year in 2021. So we have done some initial analysis. These analyses have been submitted for peer review. So there are actually several of us that were working as late as this morning on this particular article. But I wanted to just give you a few highlights. During that 2-year period, we were able to verify through death certificates 44 fatalities that were suicides among the farmer or farm worker population, or suicides that occurred on farms. We were a little bit surprised initially at the rates. The rates, however, are relatively comparable to the rate of the general US population, which is probably a relative positive. But one of the things that we found in one of those 2 years, 2017, the rate of suicide fatalities, intentional deaths, was pretty close to the national rate of unintentional injuries or unintentional fatalities on the farm. That's according to data published by the National Safety Council. A couple pieces of demographic information: 86% were men, not surprisingly and relatively consistent with other studies. The average age of those who died by suicide was in the low 50s, a little bit younger than the average principal farm operator here in the state of Wisconsin. Firearms, again, consistent with a lot of the national data looking at farm fatalities or farm suicides. Firearms were used in about 2/3 of the incidents. The other thing that we learned, or that we found through looking at Ag Injury News, a web-based database, is that a lot of times these fatalities, these deaths by suicide, were mentioned in publicly available websites, obituaries, news reports, but suicide in all 44 was never mentioned, at least in terms of the data that we looked at. It creates a bit of a catch-22 when we look at surveillance. Number one, we can't do surveillance to determine the numbers that are out there or to determine the efficacy of prevention efforts by using obituaries or news reports, unlike with farm fatalities due to accidents or injuries. And the catch-22 also is that we know that family privacy is really important. So we're not going to see a lot of news reports of suicide in the same way that we would. We're not seeing those as well in the general population. So we are going to need to really look closely at data collection methods, at alternative methods for doing surveillance. Death certificates obviously show an important promise. The bottom line on this is, if we're truly going to make a difference, both at the individual level, but also at the community level, we need more detail. We need more research, again, including at the community level and the individual level. And that's where a lot of our work is kind of coalescing with Dr. Rudolphi, with Dr. Beacott. We do have a kind of an initial review that we're doing, looking at community level risk and protective factors. That also includes Jen Kolakowski who is a nursing PhD student here at UW-Madison, and hopefully we can show some promising results in terms of advancing what we know about suicide surveillance. One of the things, Melissa, that I just wanted to mention is as we look at this issue, it really does take a village. I've talked about this with farm injury prevention and farm fatality prevention outside the realm of suicide. We need to have everybody involved, and that includes people who are selling products, who are providing services in rural communities, healthcare, mental health, education, our faith community. Everybody needs to be part of that. We oftentimes talk about that as being characterized as the social determinants of health. And so that's, I think, where the next stage of work is going to go, looking at that community level need for intervention and resources and support. Last thing I'll just mention, and I don't think I probably need to go very deep because Dr. Rudolphi did talk about this, a lot of work happening here in the North Central region. I'd say a lot of that has kind of come about through partnerships just in the last 2 years or so. I wanted to just throw out also a shout out to Chris Frakes, who at least a few minutes ago was on the Zoom. Chris and I worked together through a large partnership project with the Southwest Community Action Program, also known as Southwest CAP, through a grant from the Wisconsin Partnership Program here at UW-Madison. And we are very active in a 5-county area in southwestern Wisconsin. And perhaps during the Q&A session, we can talk a little bit more about that. Also, just a quick note, there is some early work coming out on program evaluation. If we look at all these programs, educational events, conferences, national sorts of activities, I've been quite involved with some of my colleagues who are online here, working with the American Farm Bureau Federation, National Farmers Union, and the USDA FSA, just to name a few. And I did put a link to a citation. This is an article that was published, I believe, around the middle part of 2020 that shows positive impact and positive evaluations from the work we're doing around intervention and prevention. So I think that is my last slide. Melissa, turn it back over to you.
Excellent. Thank you so much. Yes. And thank you to all of our panelists that came on today. And it's so interesting how all three of you talked about research. And Josie was talking about surveys and 12,000 surveys. John, you're talking about looking at death certificates and obituaries. And Florence is talking about doing Google searches of different resources and just how different research can really be and look. So thank you to all three of you for taking the time today to share such important information with us. So far, we don't have any questions in the chat, but if anybody has questions, please put them in the chat now. We have about 10 minutes for a question answer session. And I'm going to start out with the first question here for all three of you. And my first question to you is, you guys all shared the research that you're doing or the research that you've done. People who have heard this today, how can they find results? Like after you're done with the research, what do you do to really share your results so that farmers and agriculturalists know what you're finding and how they can help to reduce the stigma around mental health and continue the conversation?
Vanessa, that's a great question. I can start by saying what I tend to do with the people that I work with. So it's published in peer-reviewed journals, which is important in terms of first validating and making sure that the work is rigorous. But I think it's also important to demonstrate that, we do follow a scientific process. And when we go out to decision makers, they like to know that the study's been peer-reviewed. So we submit it in those scientific journals. And then we do a lot of work trying to talk more broadly to a range of folks who are directly working on the ground. We tend to write shorter pieces. We haven't had a chance yet to do it with this one, but we tend to write 1 or 2 pagers that we write for a general audience and that are really intended to just share what their findings are, what the research is. We don't go into the technical details. We did this, we did that. We're like, this is what we found. And another thing that we did recently is we, on previous research connected to health insurance and childcare, we actually wrote a short 1,000 words article that has been published for general audiences and that has been picked up by a range of different media. So it's another way that we use to try to share the information and doing presentations like today, sharing what we're doing and what we can do next with the research.
Melissa, I'll just add from an extension perspective, the same thing as what Florence said. Obviously, the gold standard is peer-reviewed research, but even in our most popular agricultural health, safety, mental health literature, there's typically fewer than maybe 500 or 1,000 subscribers. So it's really important that we get that information communicated through extension and other mechanisms, through fact sheets, folders, pamphlets, public presentations. The other thing, I spend a lot of my time, I probably spend 10 to 15% of my time writing for the agricultural media. So that's everywhere from Hoard's Dairyman to, well, you could go down through the list. We did do work back in the 1990s working with pork producers, and we found out that their primary preferred vehicle for receiving information like this that was peer-reviewed, research-based was extension was in the top 3, veterinarians were in the top 3, but also those sort of trade journals that you see the stacks of when you go into a farm kitchen or, the den or the office, you'll see those, and those often are very trusted and well known. So.
And I don't have anything to add beyond what John and Florence have already mentioned. I think working through the various media channels to make sure that people who need our work receive it. And I think what's really important is that we might present, somewhat scientific statistics, but we always want to then incorporate really applicable, relevant strategies or solutions for the audience.
Thank you very much. Another question is, what got each of the 3 of you interested in this specific research? And that might be kind of a personal question, so don't feel like you need to go too deep, but really, what got you interested in mental health and doing research there in the first place?
I could take a shot at that. I got out of graduate school. I worked in this area of health, agricultural health generally. And when I came out of school with my PhD, the first thing that I got zapped with, I was working for the Illinois Farm Bureau Insurance Company. 1998, we had probably the biggest drought here in the Midwest that we've had in the last probably 50 years or so. And mental health was huge. We were just coming out of a really bad early 1980s farm economy. That, in combination with watching what my mom and dad went through in the early 1980s, I think really gave me the passion to work in this area.
I grew up on a farm in a farm family, and so I think but I never really cared much about when I was living with my parents, it was kind of all about me. So I had the really unique opportunity to move in with my parents when I was 30 and finishing my PhD. And for the first time, I saw from their perspective what the stressors were, and I could see how I was becoming more worried. It was harvest season. We were incredibly busy. And I started to sort of reflect on that and seeing that seasonally, the farm has taken its toll on farm families. And then I moved up to Marshfield, Wisconsin. And in some of my earliest days there was a sort of a frenzy of media, popular press articles about farm suicide. And Barb Lee and I were talking about this, and she said, when you look at tractor rollovers, there's a lot of people out there doing that type of work. But when you talk about farm mental health, there's not a lot. At this point, there wasn't a lot of people in that space. John, of course, was there and a few others. And so I said, well, maybe that's something I should get into. And she said, maybe. And it's been working so far.
I think for me, I don't know that I can pinpoint. I did not grow up on a farm, but a lot of my family members, grandparents, aunts and uncles were farmers. And I grew up hearing about, I was actually thinking about it this morning. I grew up in France, and I grew up in the years where the European Union was being formed and they were putting together the common agricultural policies. And I remember at family dinners, oh man, my uncle would talk about agricultural policies and what it's doing to its hog operation. I came to research more from the perspective of agricultural economics and how people can support their farm operations and able to earn an income that allows them to live the kind of life that they would like to live. And I think that when you look at the ag economics, it's very clear that, as Josie, you were talking about, it does impact health. And I think that I've heard a lot of stories too, having my head, I don't know if having my head into different countries, but hearing what's happening in France, hearing what's happening in the US, where you have equally high rates of mental health challenges, even though those are different countries in terms of access to services, in terms of agricultural policies. And so I think the challenges of farmer mental health is not unique to the US, it's actually a global one. And I think I'm really wondering about what could we do at the global level so that we don't have to have this kind of, so that we don't have to do this type of research.
I want to thank Josie, Florence, and John again so much for joining us today, and everyone who joined us to hear about the research going on around agricultural and rural mental health. To respect people's time, I think we'll stop there with questions, but I do want to offer this time for Florence, John, and Josie to all put something in the chat for how people can connect with you if they're interested in following your research. A Facebook page, a Twitter account, or an email address, or even a web page, whatever you're comfortable sharing with people. And again, just thank you so much. And thank you for sharing this valuable insight and information. I want to give a shout out to the Wisconsin Farm Bureau Federation, who really started out the Farm Neighbors Care campaign and brought together all the different groups that really have backed this campaign and have really made it a bigger deal during May, Mental Health Awareness Month in 2021. And the Wisconsin Farm Bureau will be hosting another webinar next week, Wednesday, May 26th, from noon to 1. The topic will be farmer mental health resources. And we welcome the Wisconsin Farm Center as they share the resources they currently have available for Wisconsin farmers and agriculturalists. I also want to remind everyone to nominate someone you know for Heroes of Hope. Thank you again for your participation today, and we look forward to seeing you all again next week.